Hello, Louisiana Balance Estate and any other COCs that access this training. This is Susan Walker, System Administrator for HMIS. Unfortunately, the process of counting symptomatic cases of COVID-19 among people experiencing homelessness in Louisiana has already started. In a state of emergency, HMIS might be the last thing on your mind. I'm asking you to continue to enter data on all clients during this emergency response. We need HMIS data to tell this story. We need to know how many people whose health is at risk, what efforts work, and we need to know the names of people at every location. We also need this data to apply, for additional funding or, account for what happened. There's lots of reasons to collect perfect data right now. So this will be a short training on emergency data protocols. And I'm going to ask you to take a short survey at the end so that I know everyone received the message. This won't be difficult. We just need to enter data on clients like always and answer a few simple questions about COVID-19, like symptoms. So Gordon asked for a count of all our clients by age. Thanks to your data entry, we had these numbers on hand to help with emergency planning. They're right for planning purposes, but unfortunately I know they're a little bit wrong. Like I know there's a negative 10-year-old client in there that I haven't sorted out yet. And I personally have taken on the responsibility for the one-stop permanent housing. I know those records are wrong. I've got to straighten them out. So we know what's in there, who's there. The street outreach entries, I think, are fairly all recent because that's how you've been entering data. So that's probably a good idea of who's, potentially unsheltered right now. But if any of those people have been moved in, we want to know. We want to know where people are. So there's so many good reasons to have this information spot on right now. So basically, good head counts of everyone can help us plan and respond. So to figure out who's in your projects, you can use counts report on the dashboard. If you don't have that set up, let me know. I'll help you set it up. Tell me your project IDs. Or you can go to reports, entry exit report, search your project, put in today's date using the green check always puts in today's date. HUD as a project type, unless you're IPATH or VA, and build the report. And then you click on the blue links and it shows you your clients. And if you look at them and say, that guy's long gone, then exit that client out and make sure all the people currently there now are have records. Errors in client lists can delay emergency response and confuse everyone. So this is really important. So we have also, on a somber note, the time has come to talk about grave things. Any clients who may have already passed on, exit them now, so we're not confused about any other data that we're looking at. Think about, anyone who you might have not followed up with, or may have situations you might know about and just didn't record in HMIS, please. Okay. For different projects, street outreach, create a street outreach or path entry for every client you encounter. You can close clients who have sort of fallen off your radar, are unlikely to be unsheltered in the community right now. We don't want a list of people to be concerned about who are unlikely to actually be out in our communities right now. So, however, whatever that means to you, but definitely if you're doing street outreach and communicating with people and don't have an HMIS project to put data into, let me and Weston know and we can set something up just for emergency tracking. Okay, shelters have the hardest job right now for so many reasons. Please recognize that correct data is essential in the shelter environment too. Shelters are at the greatest risk. We need to tell the shelter client's story. We can check the data right now. Are the people who are with open entries now coming back tonight in all likelihood? I know it can be hard to keep up with people coming and going, but we're trying to minimize turnover, so that should make it easier. Client records are even more important if there's turnover. So you can call me, I'll make the updates for you every night. This doesn't apply to balance of state, but if some COCs use shelter point or the night-by-night method for tracking shelter, that's more ideal for this kind of situation because you know exactly where people are. If your shelter ends up over capacity, please continue to track in HMIS. If you're under capacity because you're trying to space people out, track that in HMIS. We can show what we did. It's great. If there's ever a time to know the name of every person, even if you're busy, it's now. We have the tool to track it. We need to use it. For scattered site and rapid rehousing, those clients are also of concern. You please set up some sort of feedback loop so they reach out to you and let you know if they're not okay. I've got a strategy for that. I'll show you in a few slides. Same goes for permanent housing. The names of all clients need to be correct. Are there outdated enrollments? Please clean them up. We want a list of exactly who we work for. Also with non-participating agencies, let us help you. You've given us PIT data all these years. We can now, by the same process, you just fill out PIT report, PIT surveys, give us that information. That can help us communicate with emergency responders and make sure that your people are accounted for. So DV providers, you know, it's just like your comparable database, just make sure it's correct. It's a tool that can aid this emergency response. So if you're moving clients in and out of shelters, make sure you capture that. Hotel rooms, capture that. If you have an additional funding source for the emergency response, let us know. We'll track it and help with accounting and let everybody know what happened. So now that we have clean lists of clients by every location, every night, we're going to record symptomatic status, and date symptoms started are the essential data elements here. The rest of this can be filled out later. It might be different from location to location. It's more for case management and internal help. I mean, we might know recovery information, but we're not doctors. We might know test results, we might not. But HUD asked us to respond to symptomatic clients. We also have the triage tool at the door to recognize symptomatic clients. So let's get that information into HMIS. We want to record this information for every client. It doesn't have to be just your client. You can update the COVID-19 status of other clients if you know, so that the most up-to-date information is in there. And the date that they become symptomatic is really important for monitoring the severity of situations, because it changes, you know, by day, and you know, the total number who may have had COVID-19 doesn't accurately characterize the situation right now. So the date that the symptoms started is really the most important information. So yes, if, oh, what I was gonna say, by every client, you screen people going in, but you might have clients that are just already at your location and you never screen them because they're there, it's their home or whatever. You don't screen people on their way into their home. So the screening is not necessary. The screening, the triage tool that LA Boss COC put out is not a requirement for entering data. There are more people who are going to need COVID-19 data than are going to be screened. So just put this data in for all your HMIS clients. Okay, so this is how it looks in Service Point. Those are the two essential ones. You could fill in any information you think is appropriate in client health notes, especially things that, you know, if we miss something in these fields, we're not capturing something important, you can put it in here. So we're only going to enter data for symptomatic clients. You could go through and fill out no right now for everybody, but it might not be true moving forward. So no and blank are basically the same thing. What we need to do is agree to update this in real time. so that it's always valid. Every day I want valid data of who might have COVID-19 symptoms, and our assumption is going to be that the other people don't have COVID-19 symptoms, not that you don't know or have no idea. So setting up a feedback loop and communication is going to help with that. Help us tell every story. Okay, if this is optional, but it's really going to help, especially if clients leave your location and go to the hospital or go to a testing site or just can't come back because they're isolated. We still want to know what happened. That's information that we should be recording in HMIS. So I would recommend that once you have the rosters correct, right now, early on, we might not be able to keep this up, but right now we can make a little postcard, a little contact card with client name, case manager name, client ID. So if that client ends up in the hospital, someone can follow up with us and say, I have your client here, this is their status. And ask clients to put it in their pocket, take it with them. I know people lose IDs and documents, but even if a portion of clients had this information in their pockets if arrival in the hospital, it's going to really help us understand what's happening with our clients. Okay, here's another public health resource. Everyone is stressed, and the CDC has recommendations for coping with stress. It's on their website. I know I'm a lot stressed, but there are tools to manage it, so it's something we need to think about. It's just a resource I wanted to share. I'm going to emphasize one more time that strong data is necessary to respond to this emergency, to track effectiveness of our response. Like, if we do really good work here and clients stay healthy, we can count that in HMIS. We can count how many clients we keep healthy. If everyone agrees to do this, can help us apply for relief funding. So we have the perfect tool for doing this. Please make good use of it. With communication follow-up system set in place, this can be very powerful. So there's a short form, tinyurl.com/C19HMIS. I'll also have the link in an email. And please be safe. Let us know how HMIS can help. And thank you for all your hard work.